Hello, Dr. Salinas.
Hi, Dr. Tony.
You have a lot of experience at Hope4Cancer, working with patients on a daily basis, seeing them come compromised with their health. And Shibuto, having 2 PhDs, one in agricultural chemicals and the second one on medicinal chemistry, knowing the impact of chemicals on the body. To that end, let's discuss one of our key principles at Hope4Cancer, which is the immune modulation. When we speak about the immune system, we want to look at both branches of the immune system, and we want a balanced immune system, not an immune system that's too active or inactive or hypoactive, right? So let's discuss, Shibuto, a bit about the innate immune system, which is the quick-acting immune system, and then jump in, Dr. Salinas, talking about the adaptive or more the long-term immune system.
Well, innate immune systems are really the superheroes of our body. You can think about the Flash or Batman or whatever, running to rescue us, whether it's from a pathogen or from anything else. Now, for most diseases, there seems to be like a black and white wall that divides disease and health. And so, for example, you get a fever, a bacterial infection, there's very clear demarcation between you being sick and not being sick. In the case of cancer and other chronic diseases, that whole thing becomes a bit of a continuum. And the innate immune system, though, is still extremely important there too. Innate immune system are the first responders of the body. Whenever they sense an external organism like a pathogen or even a cancer cell, their goal is to respond, but then their goal is to go ahead and activate the adaptive immune system, right, Dr. Salinas?
Which is a little bit more like a more targeted or more a smarter reaction, meaning that it's not just let's attack, it's more against something specific. It's like a lock and a key, for example, and it has 2 branches also. It has the cellular and the humoral part, which is cells and proteins or antibodies.
Yeah, we see every day how this immunocompromised patients that have cancer, of course, and maybe have had tough therapies, at home prior to coming. Most likely they're battling with urinary tract infections or infections in the lesions of the tumors that are open. And so, if anything, upregulating the immune system to have these infections go away will enable the God-given immune system to target the cancer as it's supposed to do and not be distracted by trying to control the infection.
Yes. That's something important because we've seen that, let's say if this table was the area where we have cancer cells there, we see a flow of the white blood cells towards the cancer cells, but as soon as we put bacteria or viruses or parasites on the table, they will kind of leave alone the cancer cells and try to attack these first. So it's very important that we get rid of all those infections also.
And in this terrain, right, what decreases the immune status is toxins, negative thoughts, things like glyphosate, right, that are in our food, in our air, in our soil, in our water. And so we need to clean that terrain. This is where all of our principles, the key principles to cancer therapy, have synergistic effects.
One of the key ones that I would add to your list is nutrition, because that is what really helps the body, the immune system build itself. It needs those key components that we are eating every day to keep itself in that healthy state.
Giving the body the resources it needs to heal, right? And let's talk a little bit about specific therapies that we have at Hope4Cancer that upregulate the immune response. And one of them that we have been doing for a number of years is the sonophotodynamic therapy, and more recently, the photodynamic therapy plus, where we're using different wavelengths of light. We're using red light, green light, blue light, and the different benefits of those. Tell us a little bit about your experience with patients with photodynamic therapy plus Dr. Salinas, any side effects, how they tolerate this therapy?
The photodynamic therapy is very well tolerated. We need to be careful with the IV sensitizers now with exposure to sunlight, for example, because our patients can get a little bit of rash, especially if they're in Cancun and they go to the beach. But it's well tolerated. They may feel a little bit of tingling or a little bit of warmth in the area where the IV is going in, but besides that, they tolerate it really good.
So sunlight is a photodynamic therapy too, right?
That is for plants.
Yes. And the sonophotodynamic therapy, Shubhruta, we've written about so often, and a lot of patient experiences with it.
Yes, for sure. And sonophotodynamic therapy, just to elaborate on what Dr. Salina was saying, we use something called a photosensitizer, which is also a sonosensitizer. They both can get impacted by specific wavelengths of light or sound. And once they get activated, they release what we call reactive oxygen species, which are high energy particles that kill a cancer cell. And since these get absorbed specifically in cancer cells, they leave the healthy cells alone. So it's really a targeted approach to get to those cancer cells. But this particular therapy has got an immune implication that is extremely important, because the moment these cells die, they send signals to recruit the immune system. So the innate immune system gets activated, the macrophages start gravitating towards the areas of the tumor, and that's when we start having a much larger impact on the cancer than the therapy could have accomplished by itself.
You mentioned a key component of the immune system, which are the macrophages. And macrophages are practically in every cell and tissue of the body. They're like sleeping policemen until they're called into action, and then they do what they're supposed to do. The Sunivera program at Hope4Cancer targets this immune cell called macrophages. Dr. Salinas, you have extensive experience with the Sunivera, which is composed of 6 components. Let's describe the effect of the macrophages, and Shubhruta, then we can go over the components of the Sunivera program and bring this together.
Well, with the Sunivera protocol, we give our patients a molecule that it's an activating factor specifically for macrophages. So basically what we do is we awaken them to start, looking for different antigens or foreign bodies in our organism to attack them, basically. And, being the biggest cell in the immune system and being able to phagocyte or eat the cancer cells in these specific subject, they are very effective in being like the first part of a domino effect of creating an immune reaction.
Okay. And for that, how important is one of the components of the Sunivera program, the vitamin D?
Absolutely. The key aspect of Sunivera is the use of multiple therapies at the same time in integration with the 7 key principles again. Propolis, for example, comes from bee pollen, and that is a fantastic product to activate the immune system. Vitamin D is an essential part of this treatment as well. As we all know, pretty much everybody in this world nowadays is deficient in vitamin D, and we all need supplementation on that. But this is particularly more the case for cancer patients as well.
In that aspect, Shubhruta, if I could interrupt for a moment, we need to understand that the considered normal levels of vitamin D by lab are way below what we want our patients to have. So preferably anywhere between 80 milligrams per deciliter to 100 is ideal of vitamin D levels in blood. If a patient is above 100, all the better, right? So vitamin D and adequate numbers of vitamin D stores in the body is important.
Absolutely. In fact, I was doing an analysis of nutrients through a little program, and I was putting in all the food that we eat, and somehow the vitamin D levels never go anywhere close to our daily requirement. So we just don't get enough vitamin D from our foods. We're not getting enough vitamin D for sunlight. Sometimes we get so much sunlight that we'll get cancer, but we won't get vitamin D, right? So
And then another component, which is the ATPI, how important is that to give us a composite of 118 nutrients, minerals, vitamins, micronutrients,
digestive
shiitake, reishi mushroom, graviola, and so many other nutrients.
Absolutely. I mean, there's so many things that ATPI does that we could spend the next hour talking about it, but it definitely has essential components that affect detox, digestion, but also very specifically the immune system. So from a nutritional perspective, it builds up the immune system. At the same time, this product also has cytotoxic effects using the acetogenins that are present as a key therapeutic component to ATPI.
And I would like to mention the Arsoda, which is the autologous antigen receptor specific oncogenic tumor acquisition immunotherapy program. And to give this to a patient, we know it's safe because it's from your own body, autologous. We're isolating the antigens or proteins that come from the tumor cells, and we are extracting them from the urine, and then we send this to a specialized lab. When we get the finished product back from the lab, we get vials that are going to be administered intramuscularly. Initially, we start with a lower volume of this immunotherapy program so that we can prep the immune system, and then we increase the concentration on a weekly basis, that way awakening that innate and adaptive immune system so that we could have what we call an antigen antibody response. Simply put, so that the antibody surveillance cells can recognize those cancer cells more readily and mount an immune attack. In addition to the Arsoda, we have the Helixor therapy.
Well, with the Helixor therapy, something that I like a lot of it is that we give our patients the dose until we see a specific response, a little bit of fever, meaning that we know that we're giving our patients the right dosage, the dosage that they need. And, by seeing that effect, we're demonstrating that we're actually activating the immune system. And besides activating the immune system, the concentration of viscotoxins that it has that are cytotoxic or are specifically to kill cancer cells. So we have, we're getting two birds with one rock there.
The key principle of immune modulation brings the 7 key principles together because they're all working in synergy with each other. And this was a wonderful discussion how we can regenerate that immune system that God gave us, and it knows what to do. But with all the stressors in life, toxins in our environment, and antibiotics and aggressive therapies that destroy our gut health, we're having a suppressed immune system, and cancer patients are making it more difficult for themselves to recover and to have that optimal immune system that'll give them a more favorable outcome. So thank you, Dr. Salinas, and
welcome.
Thank you, Dr. Shibito.